Assalamu alaikum. Assalamu alaikum.
Assalamu alaikum, everyone. Peace be unto you. Thank you for tuning in to Islamic Learning with Masjid As-Sabur. I am Adrian Jasper, and Masjid As-Sabur, we are located at 4926 15th Avenue, which is off of Stockton Boulevard here in Sacramento. And you can visit our website at www.masjidassabur.org. And you can also come to our Friday prayer services every Friday at 1:30 p.m. They're open to everybody. Come and listen and learn and meet our community. We're good folks. So today we have two very special guests from our community here in Sacramento. We're going to talk about SIDS, Sleeping Infant Death Syndrome. And we have here Kalyca, who is from the Child Abuse Prevention Center. And then we have Jasmine from the Center of Community Health and Well-Being, and they're going to talk about this issue in Sacramento, how a disproportionate of Black children are the ones who are whose babies are between ages of 0 and 4 months that are dying from SIDS. So, tell us about that.
All right. So just recently, there was a lot of data that came out that talked about the disproportionality of African American child deaths in Sacramento County. One of the 4 main causes of death for African American infants was infant sleep-related deaths. And so First 5 Sacramento put some funding towards the Safe Sleep public education campaign. And so we are out doing education to providers, parents. We are talking to medical professionals and really just trying to get that information out about the child deaths and infant sleep-related deaths. So we're really glad to be here. So thank you.
Thank you.
Yeah.
So Jasmine, tell us a bit about your organization.
Well, I'm from the Center for Community Health and Well-Being, and we are a partner with the Child Abuse Prevention Center, and we go out into our community and we share this education with families. We come and do in-home presentations. We work with schools and the high schools and just anyone in our community, grandparents, anyone that's a caretaker for an infant. And we provide the education and just want everyone to have a consistent message that it's safest to put a baby to sleep alone on their back and in their crib. And those are the ABCs of safe sleeping. And so that's what we're here to do today.
Okay. So, and you came to Masjid As-Sabur recently and you gave a presentation and you shared some information about the different neighborhoods in Sacramento where deaths are. Can you share that information about?
Sure. And actually, if I could use your paper, thank you. Sacramento is highest. The neighborhoods that are highest affected are the Meadowview, Mac Road, Valley High area. That's the 95823 zip code and 95832 zip code. The next is Del Paso Heights and Arden Arcade. So we have received expanded funding. Our program initially was focused in the south area of Sacramento. So now we're expanding and trying to reach the entire county and the most affected neighborhoods.
Wow. So why are these neighborhoods? Why are these neighborhoods the most affected by this, according to your statistics and research?
Well, one thing we found is, every other week in Sacramento County, a baby dies while sleeping. So we know that is the statistics for the county, and half of those deaths are African American infants. And so we find that in these neighborhoods, there are a lot of African Americans who live in these neighborhoods. So we have really gone out into the community and talked to the community, asked them what their opinion was. Mm-hmm. We have asked them for feedback on how they sleep their infants and their babies, and we found that a lot of people are co-sleeping. So they are sleeping with their baby in the same bed with them, as well as a lot of times there are other items in the crib or surrounding the baby when they're sleeping. So those are suffocation hazards.
Wow.
So pillows, blankets, extra comforters, bumpers, all of these items around the baby when they're sleeping are suffocation hazards. And those two are the biggest risk factors that we found, not just in Sacramento County, but nationally as well.
Okay, so why should a baby sleep by itself?
Well, the biggest risk factor is co-sleeping in Sacramento County. So when a baby is sleeping with other adults or other children, they are not getting the amount of oxygen that they need. Sometimes we find that somebody will roll over on the baby, which will suffocate the baby.
Wow.
And that can be even a twin. Twins love to sleep close to each other, and they can accidentally suffocate each other.
Wow. So when women are breastfeeding babies, they tend to, breastfeed and then go to sleep.
Yes.
So what would you recommend for women who are breastfeeding babies after they breastfeed? What should be the next step?
Yeah. So, breastfeeding is definitely recommended and has been found to be a protective factor that helps babies. And so one of the recommendations is to put the baby in a crib or a bassinet next to the parent's bed. Because a lot of parents want their baby close to them.
Right.
So putting the crib right next to the parent's bed in the middle of the night, they're tired, they breastfeed or they soothe the baby, and they can put the baby in the crib right next to them.
And I know I can just add on to that because I was a breastfeeding mom, that it is very challenging, sometimes because you're exhausted as a new mom and you're very tired and you want to do the best by your baby, so you want to breastfeed, but it is critical that at that time that you do move the baby as soon as you're done nursing the baby and place them on their back in their own sleeping environment, because that level of exhaustion, being a mom, especially a new mom, first-time mom, you're really not able to gauge how tired you really are. And sometimes internally we think, I can control it. I know if I'm going to roll over. I know if I'm going to fall asleep. I have it under control, but we really don't. And so the safest thing for your baby is to lay them down in a separate sleep space, like she said, and we recommend room sharing without bed sharing. So putting the crib or the bassinet right up against the bed, but not in a separate room, so that you can feel the same closeness that you need with the baby being close to you but not with you.
Right. So I know traditionally, especially in the African American community, grandmothers and mothers have always told us put the baby on your stomach, on its stomach. So why is that incorrect?
So a lot of research has been done recently looking at whether it's safer for the baby to be on their back or their stomach. Traditionally, yes, a lot of people say put the baby on their stomach, and even 20 years ago, pediatricians and doctors recommended that babies be on their stomach. But a lot of new research has come out, and they found that it really is safer. The choking hazard for babies is lower if the baby's on their back. And as well, it opens up the baby's airway. If a baby is on their stomach, they can suffocate on the mattress or the pillow, and so it's safer if their airway is open. So, yeah.
So what about blankets? How should blankets be in the crib with the baby, or how should blankets be positioned should they be covered? Should they be uncovered?
Well, we recommend, and I wish I had one here today, it's called a sleep sack. And so what it is remember, I don't know, maybe I'm dating myself, but back in the day, there were nightgowns for the baby that were closed at the bottom, or it was like a drawstring. So now the sleep sacks are completely seamed off at the bottom, so there's no string at the end. And so it's like a bag. So the baby goes in the sleep sack and it zips up. And they come in different textures, so they're different levels of thickness for warmth for the baby, but it's one enclosed piece. so the baby can't struggle in the night and get the bag over their head like they could with a blanket. It's not loose, and it can't get anywhere near their mouth, obstruct their airway. So we recommend that, and then we also recommend that you gauge your temperature in your home. And so the temperature in the home should be not too warm, not too cold, but comfortable for you. And if you're comfortable, the baby should be comfortable as well. So there shouldn't be a need for you to put excess blankets and bedding around the baby, because overheating is also a real concern. Babies can't regulate their own internal body temperature. So it's important that we, as the parent or the caregiver, pay close attention to the temperature and how many layers are on the baby.
Yeah, because oftentimes, you do see babies overdressed. People put babies to sleep and they're wearing socks and they're wearing those little those little caps, and those zip up flannel nightgowns,
right,
and the heaters on, and then the blankets on.
Right.
So, what is appropriate?
And like you said, it is a cultural thing. It's something that's been passed down over time. But we've learned more about the causes of infant deaths and babies dying. And one thing that we know is that when babies get something in their hand, they love to put it in their mouth. Like that's how babies learn. And so a lot of times the blankets and the loose items, they get that in their hand in the middle of the night and they don't even realize it, but it's a suffocation hazard. And so instead we really recommend that, it's something that's fitting, doesn't come off of the baby. So blankets, even if we swaddle the baby in the blanket or, wrap them tightly, a lot of times babies get out of those. And so they end up either rolling over into them or putting them in their mouth. And so it's just, a onesie. The sleep sack is a really good idea, but something where the baby can't get out of that sleep sack. Or,
Okay. So is it okay for a baby to sleep on its side?
We do not recommend side sleeping. The safest way to put the baby to sleep is on their back. And I know that, like she said, that has changed over the years. I've 15, 20 years ago, that was the recommendation of my doctor for my oldest, was that, she be on her back or on her side, either one. But now the recommendation is strictly on the back. And just like Kalyca shared earlier, it's all about the choking hazard and lowering those risks for the baby. So if the baby is flat on their back, the way that our bodies are made, you have your trachea in the front of your throat and your esophagus in the rear. And just the way that gravity works, if the baby's on their side or on their stomach and they spit up in the night, the liquid that remains in the back of the throat can still drain back into the body. And so we want it to drain down through the esophagus into their stomach and not into their trachea, because she said that airway is open. So we want to make sure that the only thing that's going down that airway is oxygen for the baby.
So when they're on their back, that liquid is going to drain downwards and not come
forward to the front of the throat.
Okay. Wow.
Yes. And one thing about side sleeping, babies' stomachs, their necks, they're not strong yet. And so a baby is just as likely to roll over onto their stomach in the middle of the night if they're on their side as they are on their back. And so it's really important that a baby's on their back, because once they get to about 4 months old, then they're strong enough to roll over. But before that, they really don't roll over too much. So that hazard isn't as strong.
So if a baby rolls over, so my daughter is grown now, so I'm trying to remember the stages. Between 0 and 3 months, are they able to roll over on their, if you put them on their backs, are they able to roll over on their stomachs?
So typically that developmental stage occurs around 4 months old.
Okay.
It can obviously, every baby is a little different,
Right.
so sometimes it can happen a little bit earlier, but typically it's around 4 months.
Okay.
But they learn how to roll over from their back to their stomach first, and so they can't roll back over onto their back yet. So But it's really important that, in parents who have a baby who's learning how to roll over, you don't have to wake up in the middle of the night and roll them back over onto their back,
Right.
because at this point their neck muscles are stronger, their stomach and their back muscles are a lot stronger. So that risk factor isn't as strong because they're starting to really develop a little bit more.
Now, one thing that we would always hear was, "Oh, don't put the baby on his back because he'll get a flat, he'll get a soft spot on the back."
Yes.
And we hear that.
So very common.
So address that.
Well, the flat spot, it's funny because I've had different doctors tell me different ways, but the baby, I don't know what the exact length of time would have to remain like in this position for a very, very long time.
Mm-hmm.
That means you're not picking up the baby, you're not engaging the baby, you're not playing with the baby. I know that when my grandmother says you have to massage the head. I've never massaged a head before, but all my kids have round heads. So I think that the idea is that when you have the baby is sleeping on their back, but then you have awake time. And that's when we recommend tummy time with your baby, and that's when the baby is awake and active, and then you can lay the baby on their stomach and supervise active tummy time. So not when they're drowsy, not when you're drowsy, but when you're both awake and active, and then just making sure there's a balance of time that the baby spends on their stomach versus time that they spend sleeping on their back. So when they're awake and engaged, you make sure you give tummy time so that the baby can develop their core and their muscles and their neck control, and then not have a flat head as well. Which is bonus.
Okay, so you can stop placing them on their back about 4 months.
We actually recommend keeping all of the recommendations until the baby turns 1 year.
Okay, 1 year.
Yes.
Okay, so what about crib bumpers?
So bumpers, they're tricky. They are not recommended by the American Academy of Pediatrics.
Okay.
Because they can be a suffocation hazard, and sometimes they found that babies will get caught in them. So the way that cribs are made now, they have a lot of protections, safety features, and so if you put a baby in a crib or a bassinet, they're not likely to get stuck in the crib. And that was one of the big concerns why bumpers became a big thing, is that fear that the baby would get their leg stuck or their arm stuck. And now the slats between the cribs, they're a lot smaller. And so we don't find as many babies getting stuck in them because of those safety features on cribs.
Okay.
So there's really no need for the bumpers. And especially because the bumpers end up being a suffocation hazard.
Wow.
So, yeah.
So now, if a person is, someone is babysitting a person's baby, and that babysitter, of course you want the babysitter to be educated too.
Right.
So, what would you recommend parents when they take their kids to the babysitters to relay to the babysitter?
Yeah, so definitely just talking about what they've learned. We have a brochure as well as a DVD or a video. It's the Safe Sleep Baby Sacramento video. If you Google it, it will show up on Google from our YouTube. Parents can have access to that video if they want to share that, as well as the brochure. So if they wanted to share that information, they could.
Okay, so say the website again.
It is www.thecapcenter.org.
Okay, and so what organizations do you work with for presenting this information?
Well, there's really no limit. The education is free. It's available to anyone in Sacramento County. And that's, like we said, that's for parents, that's caregivers, could be grandparents, aunts, uncles, anyone that is going to be spending time with the child, because these practices need to be put in place for every sleep. So that's nap time and bedtime. So doesn't just have to be the parents. Could be, like you said, the babysitter. or the friend or the neighbor. So our goal is that the message gets out to as many people as possible, so that everybody understands that this is the safest way to put a baby to sleep. The parents are not always with their children.
Right.
So I know that we've had quite a few grandparents that have asked for the training, and then even we've gone out to churches, like we went to the masjid, and everybody wants to play a role. Everybody wants to be educated, because our babies are greatly affected here in Sacramento County. And so I think it's important that even if you don't have a child, that you seek out this information, because you never know when you may be in the company of an infant.
Right.
And maybe you would be the one that can make a difference if you see something that is being improperly handled with regard to putting the baby to sleep.
Right. So now, when what would be your ideal audience to, like, if you could be in front of a group of people to give this training, who will be your ideal group?
Anybody who is around babies. I mean, we are definitely targeting the African American community, because the African American community in Sacramento County is so affected. As well, child care providers. A lot of parents send their kids to child care.
Wow.
So it's very important that even child care providers learn about this. And, parents, grandparents, like she said, aunts and uncles. It's really anybody who's going to be around the baby.
So when people are like in maternity wards before they leave the hospital, have you guys ever had a chance to go into hospitals, maybe even educate like the nursing staff? Do they teach this to the babies?
So yes, we are working with the Sacramento County hospitals.
Okay, wow.
All the hospital systems to get this education in the hospitals.
Wow.
It's a bigger organization, so it's a little bit hard to have us kind of dictate what kind of education they give. But we are definitely working with them, and they are really receptive, and they want to share this information. And so we are educating nurses, we are educating social workers, medical providers, whether they're pediatricians or OBGYNs. So anybody who's interested, it's a great training to go through, and just to learn about something that's really happening in our community.
Wow. Yeah, and that would be beautiful if before every woman who just gave birth in Sacramento, if before they left the hospital, they had this training. That would be beautiful. So we're putting that wish out. We're here in Sacramento. We want every nurse and all the nurse staffs in Sacramento to give their babies, or have these women come here, and get this training to the mothers, the new mothers, so that before they leave the hospital, they can know this, because this is important.
Yes. And so far, we have had some great reception from the hospitals. It takes a longer time to get out there and to train all the staff and get it out. So we are working on that.
Well, that's beautiful. So because there's a verse in the Quran, and it says, to save one life is as if you save entire humanity. And so we're saving these babies. We don't know who these babies are going to grow up to be. So we have to save all of them, because you don't know who you're looking at. You could, we don't know who these babies are here to be. So saving one is like you're saving all of humanity, because that could be the next person to lead people out of all the we don't know. We have another little baby Jesus, and not even so we have to look at all of our babies that way. It's like that they're that precious. We don't know what their spirit is here to be. So we have to save them. So I thank you guys so much for coming and sharing this information with us. So again, what if people want to have you come and present this information? Where can they go to contact you?
Well, the Center for Community Health and Wellbeing, like I said, one of the subcontractors for the Child Abuse Prevention Center, and our number is 916-558-4812. And we schedule trainings, like I said, anywhere in Sacramento County, and the workshops are completely free. One thing I will add in is, if we have a family that's in need of a crib and they don't have a place for the baby to sleep, we can provide a crib for that family. And so we'd love to be able to partner and help as many families as possible.
Okay, and is there a website?
Yeah. The best website
would be the www.thecapcenter, so CAPcenter.org.
Okay.
And that's the Child Abuse Prevention Center.
Okay.
website.
Thank you so much.
Thank you.
Thank
And
you.
Thank you for tuning in again to Islamic Learning with Masjid As-Sabur, and hope you really got something out of this valuable information for all of our community in Sacramento. And again, we're located at 4926 15th Avenue off Stockton Boulevard. Our website is www.masjidassabur.org. Again, thanks for tuning in. God bless. Assalamu alaikum. Peace be unto you.
Assalamu alaikum.
I want to remind everyone, Masjid As-Sabur, 4926 15th Avenue. Our new masjid is gorgeous. We just finished planting over 100 plants in front of the masjid. We just got through cleaning up the kitchen and getting ready to clean up all of the wudu stations. And we want you to come and join us. Every Friday, 1:30 p.m., Masjid As-Sabur, Sacramento. We are also on the web, www.masjidassabur.org. And we're on Facebook, so please like us. Again, we thank you for your patience and your time. We want to remind you that God truly has a message for you. And we want to remind you that we are here to give you any help that you may need. As God has taught us, He is a merciful God. As long as you come to Him and ask forgiveness, He will forgive you. So no matter where you are in life, there is a hope for change.